Hello, dear friends. My name is Sofya Dorinskaya. I am a psychiatrist and the head of the Center for Medical Information. Today, I want to talk to you about how to preserve your teeth. But even if over the course of your life you have lost your teeth, this information will still be very useful for you. Why? Because today we will discuss and I will tell you about a vitamin that is responsible for the condition of your bones. Let's start by referring to the book Avitaminosis and Hypovitaminosis by Professor Slepsky. We are publishing this book. And what do we find here on page 32? Here, the professors present observations, an experiment they conducted on a large group of school children. In the control group, that is, the group of school children who were not given this vitamin, the number of carious teeth by the end of the observation period increased by more than 50%, and among the carious teeth that were present at the beginning of the study, 28.7% showed a worsening of caries. At the same time, among the school children who received 20 milligrams of ascorbic acid daily for 8 months, by the end of the observation period, the increase in the number of carious teeth was found to be only 3.1%. In comparison with the 50% in the control group, and only in 0.6% of the existing carious teeth did the process progress. For comparison, it was 28.7% in the control group. So Professor Slepsky took a group of school children and divided it in half. The control group did not receive vitamin C. The experimental group received 20 milligrams of ascorbic acid daily for 8 months. The children who did not receive it had a 50% increase in the number of carious teeth, and the caries they already had increased by almost 30%. The children who received vitamin C 20 milligrams daily for 8 months had only a 3.1% increase in carious teeth, and in just 0.6% did the existing caries progress. When I read this data, it was truly a revelation, because as it turns out, and as our own observations confirm, since we have been working for almost 5 years now on providing people with programs to eliminate deficiencies, the health of our bone tissue is closely tied to whether there is a significant deficiency or a complete absence of vitamin C. Then, I discovered some truly fascinating information about it. In a study, Pediatric Issues During the Blockade of Leningrad, Nutritional Dystrophy and Vitamin Deficiency in Children. And here I found the clinical sign of vitamin C deficiency that I had never come across before. Most children complain of pain in the bones of the lower leg, often worsening at night. Apparently, this is an early sign of vitamin C deficiency. Please, dear adults, think back to your own childhood, and perhaps you notice this in your children. Ask your children if they, or if you, when you were a child, have ever felt pain in the bones of the lower leg that gets worse at night. So this indicates that the child has a vitamin C deficiency. And if you don't pay attention to this, or if you are already an adult and naturally, when you were a child, the adults missed this sign, then now you can judge by the condition of your teeth. Most likely, they are mostly decayed, treated in the best case scenario, or in the worst case, you have already lost your entire row of teeth. So vitamin C is the vitamin responsible for bone tissue. I believe that the combination of this data and our observations, which confirm this, is one of the major discoveries and significant observations. Furthermore, if you are currently struggling with dental cavities, or if you are experiencing deep bone pain, and if right now you are someone whose skeletal system is truly suffering, then most likely, and I firmly believe this is the case, you are a person who is suffering from a condition known as scurvy. I can say that this is indirectly confirmed by the fact that, for example, drugs based on valproic acid, which are used to treat epilepsy, led to osteoporosis, including in children, and to severe osteoporosis at that. but these drugs destroy the liver. The liver is responsible for our mineral metabolism, and also the primary, let's say, process involving vitamin C takes place in the liver. Vitamin C has a very strong effect on the liver, and valproates, like any toxic substances, lead to vitamin C deficiency. And in this complex, indirect way, we can say that this also indirectly indicates that vitamin C is the main vitamin affecting the condition of bone tissue. And I think that now you might say that there are tests for vitamins, and now I might rush to get tested and I might not have a vitamin C deficiency. I can say that unfortunately vitamin deficiencies cannot be determined by blood tests. I've already said this, but I'll repeat it. All tests are auxiliary methods of examination. Remember, absolutely all tests are auxiliary methods of examination. Only a doctor can make a diagnosis. As for vitamins, unfortunately, blood tests for vitamins are absolutely uninformative. It's like, for example, you go to a store and the shelves are empty, but according to the invoices and official documents, the store is overflowing with goods. What am I trying to say? For example, there is a condition that has been described called magnesium deficiency and hypomagnesemia. So, hypomagnesemia is when the amount of magnesium in the blood is reduced, while magnesium deficiency is when there is no magnesium in the cell. And these are two different conditions. That is, a person may have normal magnesium levels according to blood tests, meaning they do not have hypomagnesemia, but still have a magnesium deficiency. And unfortunately, blood tests are not informative. Avitaminosis and hypovitaminosis are specific diseases caused by nutritional deficiencies, very specific ones. And unfortunately, in order to diagnose them, you simply need to be aware of them. You need to know how these diseases develop. You need to know their clinical signs. You need to know which diseases are fundamentally caused by hypo and avitaminosis, and which specific types of hypo and avitaminosis are involved. And you need to know the combinations of these hypo and avitaminosis. In other words, what is primary and what is secondary. Because unfortunately there are situations when a person has scurvy, takes vitamin C, and it doesn't go away completely because it's a combined avitaminosis. And in that case, you need to address it specifically. We deal with this in our nutrient deficiency tests and during our consultations. There are also conditions that unfortunately have not been studied and that lead to the most severe consequences, specifically due to vitamin C deficiency, to scurvy. I want to share with you a quote from the proceedings of the All-Union Vitamin Conference, which took place from June 19th to 23rd, 1939. And at this vitamin conference, a report was presented by Doctors Alperin and Iosikova from the Moscow Institute of Blood Transfusion. So, what did they write? In patients with leukemia, it was not possible to achieve saturation of the body with vitamin C. How did they check? Just a small remark, how did they determine whether a person's body was saturated with vitamin C or not? A person was given vitamin C in increased doses, and they observed when vitamin C would start to be excreted in the urine. Because in humans, vitamin C does not transform, there is no mechanism by which vitamin C changes, unlike in animal organisms. Therefore, we can determine whether a person's body is saturated with vitamin C or not by giving a dose of vitamin C and finding out when unchanged vitamin C appears in the urine. So, they gave people with leukemia vitamin C, and in patients with leukemia, it was not possible to achieve saturation of the body with vitamin C. That is, excretion of it in the urine did not occur despite prolonged loading. A flat excretion curve. This contrasts with the high initial levels of ascorbic acid in the blood and suggests a profound endogenous disorder in the absorption and metabolism of vitamin C in leukemia patients, as well as the destruction or irreversible oxidation of ascorbic acid. What happens in the body of a person with leukemia? Why is vitamin C destroyed and not absorbed in them? Unfortunately, there is no such data. I think that we will no longer find the drafts or the original documentation of these studies. You understand yourself, this was in 39. 2 years later, the war began, and we don't even know whether these scientists survived the war or not. And, well, how about what happened next to these people? But I think that we will definitely not find these studies. But if there are any scientific groups or institutes that are interested in this topic, here you go, here's the topic for you. Vitamin C is destroyed. Why did I mention this? The point is that vitamin deficiency can only be identified by its manifestations, only by knowing the clinical picture, as well as knowing what secondary pathologies are caused by a particular vitamin deficiency and what combined deficiencies exist. You simply need to know this. Why is it that a person's vitamin deficiency does not resolve when you give them the appropriate vitamin? In that case, you need to look for a combined vitamin deficiency. By the way, in this case, there may have been a severe combined vitamin deficiency. Why do I think this information is important even for people who have already lost their teeth? Because, for example, in order to get implants, a person needs to have very strong bone tissue. But if a person has hypo or a vitaminosis C, even if they get implants, when the implant is screwed into the gum, the implant, and when there are 2 posts in place, the bone between them can simply break. And at that point, there's nothing that can be done at all. That's why strengthening bone tissue is very important, even if you've lost your teeth, because then you still have a chance for certain dental procedures where your dental arch can be restored, even artificially, and these implants will be securely fixed and your jaw won't fall apart. I hope you found my message interesting. And maybe some of my colleagues will take an interest in this topic. Perhaps someone has the resources to even research the data on vitamin C that I mentioned. That's all. And I am very glad that you were with us today. All the best. Goodbye. Stay healthy.